So, with everything going on in the world, this whole coronavirus or the COVID-19, I thought it might be interesting to jump ahead just a minute and spend some time talking about epidemiology. So, we're going to jump to chapter 29, then we'll come back and pick up with chapter 11, genetic exchange in bacteria. But I thought this might be something interesting for you and relevant for our current times. So, epidemiology is the study of basically how diseases spread in a population and the overall health of the population. So these epidemiologists study the occurrence, the distribution, the determinants of health and disease in a population. So if you've seen the movie Contagion, Kate Winslet, her character is an epidemiologist. So is Lawrence Fishburne. And then if you watch Outbreak, Renee Russo, her character is also an epidemiologist. So these are generally people who work for government agencies, even, city and county departments of public health, state and federal governments. Their goal is to identify what a disease is and how it is being spread. So with this current coronavirus, doctors began reporting weird clusters of pneumonia. And eventually it was tracked back to a viral infection that was being spread by respiratory droplets, and it was identified as a novel coronavirus. In developing countries, because of a lack of healthcare infrastructure, often infectious diseases are some of the leading causes of death. So in a country like the US, in most of Europe, what we see as leading causes of death are more diseases of aging, like cancer, heart disease, or diseases of lifestyle, like diabetes caused by obesity, or hypertension and things like that. But illness caused by infection is the leading cause of death in other parts of the world. So a couple of the terms that we talk about when we talk about epidemiology are the incidence and the prevalence. So incidence refers to the number of people who are being infected over a certain period of time. So if, in this case, 650 people every 5 days on this diagram get the infection. It could be, 10 people a day are showing up with the infection. That is the incidence. The prevalence represents the total number of people who are infected at any given time. So if we're constantly adding people, let's say it's a week-long infection, every day 10 new people get infected. So on Monday, 10 people got infected. On Tuesday, 10 people got infected. But those people from Monday are still sick. So we had the 10 people from Monday, 10 people added from Tuesday, so we're up to 20. 10 more people on Wednesday, so we're up to 30. 10 more on Thursday, so we're up to 40. So the prevalence is that larger number, the number of people who are currently ill, whereas the incidence represents the number of new cases in a certain period of time. And so, as you are probably well aware, we are currently in the middle of a pandemic. It started out as an epidemic. In parts of China, particularly the Wuhan region, there was an increased incidence of this novel coronavirus. And so at that point, it was an epidemic. And it began to spread outside of China to some of the local countries, Japan, Korea, and then it was still an epidemic because it was kind of localized, but a large number of people. As it began to spread into Europe, like Italy, the UK, France, into North America, especially the US, it became a pandemic. We also use this term endemic to refer to disease that is constantly present in a population, but usually at a relatively low rate. So in California, we have a fungal infection caused by an organism called Coccidioides immitis. We call it San Joaquin Valley fever, or sometimes they just call it valley fever. So every year, a low number of people get that infection, but it's local to, that's why they call it valley fever, it's local to the desert Southwest. Lyme disease is also one of these diseases considered to be endemic. It's not found all over the country, only in areas where you have the appropriate tick and you have interactions with the host. Individuals that are infected with the pathogen, especially one that causes an endemic disease, are called reservoirs. So if we think about Lyme disease, the reservoirs for Lyme disease are usually small mammals, most often rodents, because the bacterium that causes Lyme disease can replicate inside of the rodents and then can be transmitted to people. So those would be the reservoirs. In diseases that are spread person to person, people are reservoirs. In this coronavirus, it's likely that some unknown animal, they're suspecting that perhaps it's a pangolin. So, I mean, poor pangolins. They're so cute, but, now they're coronavirus spreaders. Might be the reservoir where the virus is hiding and we don't see it, and then it jumps into people. So here they're showing in North and South America what endemic disease would look like. You have clusters of cases, but small numbers in this area. Here they're showing epidemic in one epidemic up here, maybe centered around like Illinois, up here in Maine, and then down here in Brazil. And now they're showing pandemic, where we have large numbers of cases. It's supposed to be worldwide, but at least in the Western Hemisphere. So this animation will show you a little bit more about what we're talking about.
The prevalence of a disease is the number of cases, including both new cases and previously existing cases. The expected prevalence of a disease is the prevalence that's expected based on patterns established by past observations. The incidence of a disease is the number of new cases over some period of time. Let's see how epidemiologists use prevalence and incidence data to evaluate the status of a particular disease. A disease is sporadic in a region if only a few cases occur in that region. A disease is endemic in a region if it normally and continually occurs there at a fairly stable rate. A disease is epidemic in a region if it occurs there at a rate significantly higher than would be normally expected. A disease is pandemic if it's an epidemic on more than one continent at the same time. Now watch the incidence and prevalence data and see if you can recognize when an epidemic or pandemic occurs.
Okay, so we're watching. So far, everybody looks okay. Nothing's happening. And now it looks like we have an epidemic in North America. Okay, it's gone down. Uh-oh. And so now we have an epidemic. We had an epidemic in North America, Europe, the Middle East, East Asia, South Asia. So that was a pandemic. Here we go again, Africa, South Asia, East Asia. So by the text definition of it being on more than one continent, that epidemic that showed up in both Africa and East and South Asia technically is a pandemic because it's in multiple continents. But you might remember that the World Health Organization just recently declared COVID-19 a pandemic, even though it was really just wreaking havoc in Europe and in especially East Asia. So though it fit the textbook definition, sometimes government agencies are a little bit reluctant to throw around that word pandemic because it's a loaded, scary word. So in epidemiology, what they are looking for are the stages of disease. And so these are the 5 stages of disease. as long as the person recovers. If a person doesn't recover, there are fewer stages. So the beginning for everybody is infection. The organism gets into and begins to colonize the host. This is usually pretty brief. It's when you're first exposed to the organism and it successfully takes hold. The incubation period is the period where the organism has gotten inside of you and it is growing and replicating, and you don't know it yet. So this is the period before the onset of symptoms. This is a really scary period for epidemiologists, public health professionals, medical professionals, because there are some infections that can be transmitted during the incubation period. Meaning you don't know you're sick, you go out and do your normal stuff because you don't know you're sick, and you can be spreading viruses or bacteria and making other people sick as well. And so this is one of the concerns with this COVID-19, is that people who are in the incubation period, people who are not experiencing symptoms, are still capable of spreading disease. During the acute period, even though its name says acute, it is not cute. This is when you feel like garbage. This is when you are experiencing symptoms, you have a fever, you're tired, you're throwing up, whatever the symptoms of the disease are, you've got them. And depending on the infection, who knows how long this will last. Sometimes you get one of those, 24-hour stomach bugs where you're in the bathroom for 24 hours and then after that you're fine. Sometimes you get a viral respiratory infection and you're knocked out for a couple of weeks. It really just depends on the infection. It depends on your overall health. It depends on your genetic predisposition, your vaccine history. So that's why everybody responds differently to different types of infections. Now, provided you survive the acute period, which most people do, you begin the decline period. And now this is not your decline. This is the decline of infection. This is when maybe you're not throwing up anymore, but you're still kind of feeling nauseous, or you're not coughing up a bunch of mucus, but you still have some tightness in your chest. So you still don't feel well, and you still are experiencing symptoms of the disease, but they are not as strong. And then finally after that is the convalescent period. This is when you no longer have symptoms, so you don't have the upset stomach, you're not coughing and sneezing, whatever the symptoms were, but you probably still feel pretty bad, right? You are recovering, so you're going back to your normal strength. And that's why sometimes these infections, even though, hey, I was only throwing up for a day, but man, I felt bad for like 3 or 4 days after that. It's because it took you that much time to get your strength back, to get rehydrated, to have your immune system go back to normal. And so this convalescent period is also a period where you might be a little bit weak and more prone to other infections. And so sometimes with infections like the flu, during the decline and convalescent period, you're actually recovering from the flu, but you could still be more prone to secondary respiratory infections as well. So it's really important to keep yourself isolated, resting during these periods. And you could also be spreading the disease as well. So with any infection, it's really important to stay home, rest, and try to recover before you strain yourself too much. Other terms we use include mortality, morbidity, and daily. And I'll explain daily in just a minute. So mortality, well, it's kind of like it says. How many people died? It's the incidence of death. It's when they say, 3% mortality, meaning 3% of the people who get the infection will likely die. So that's kind of what we're looking at with this COVID. And in prior outbreaks of diseases like Ebola, that mortality rate hovers around 90%. In the more recent Ebola outbreak in 2014, 2015, the mortality was closer to 50%. Still awful, but a big improvement, especially with improved recognition of symptoms, and improved patient care. Morbidity refers to how many people have the disease, including people who die and people who don't die. So morbidity is like basically it's similar to prevalence, right? Except morbidity refers to maybe how many people in the overall population, not just in a snapshot. So we could say something like 50% of the people are going to get this infection, but that doesn't mean they're all going to have it at the same time. So having it at the same time is the prevalence. Whoever has it on Wednesday, that's the prevalence. But whoever has it, this Wednesday and a month from now, that would be the morbidity caused by the infection. The daily is the disability adjusted life year. So being sick doesn't just affect you during the period when you are sick. Sometimes you could get sick when you're a child and you recover and you're fine. But what you didn't know is that perhaps that infection you had as a child caused some damage to, let's say, your circulatory system or your heart. And when you're older, that damage could actually kill you prematurely. So lost years, right, due to the disease, premature death. Maybe a disease left you disabled, something like polio. You were only sick with polio for like a week, but now you're paralyzed. So this takes into account basically the human cost of a disease, not just in terms of someone who died right away, but the downstream effects of those types of infections. And again, while, it says hundreds of millions, billions of people on the planet at any given time have some kind of infectious disease. And the majority of them survive. But again, those impacts on the individual, on their family, on the community can be long lasting. So we don't know what this COVID-19 is going to do to something like our economy, people's jobs, downstream effects on long-term recovery after people have had the infection. We don't know. And so the daily of COVID-19 might be quite high. So that's one of the unknowns, and that's something that epidemiologists try to predict. Here they're showing you the percentage of deaths worldwide due to infectious diseases. So if these are all of the infectious diseases that kill people, 31% of people who die of infectious disease die of respiratory disease, 15% die of diarrhea. In other parts of the world, the leading cause of death in children under the age of 5 is diarrhea.